What is the major difference we face in transplanting men versus women hair? Did you know the hair transplant procedures are not the same for men and women? Let's find out the difference.
Dr. Sandeep, a lot of people assume that hair transplant procedures are the same for everyone. But what are the major differences you face when transplanting men's hair versus your woman's hair?
That's a great question and something many people don't realize. The basic technique, whether it is FUT or FUE, remains the same, but the approach, the design and planning are very different from men compared to women because the pattern of hair loss is different.
Could you explain how the pattern differs?
Of course, men typically face male pattern baldness starting at the temples to the crown, which can progress to complete baldness on top. Women, on the other hand, usually have diffuse pattern thinning. The hair becomes thinner all across the scalp, but the frontal hairline often remains intact. So in women, the goal is to add density and fullness and not necessarily to fill the bald patches.
That's interesting. How about the donor area? Is that different too?
Yes, and that's one of the biggest differences. In men, the donor area, usually the back and side stays dense and unaffected by hormones, so we can safely extract the grafts or follicles. In women, even if the donor area can sometimes show thinning, so we have to be very selective while extracting to maintain natural density. It is more delicate and a precise process.
So, does that affect how many grafts can be transplanted in women?
Exactly. In men, we can often extract a higher number of grafts, sometimes 3000 to 4000 grafts or more. In women, we usually work with fewer grafts because our goal is to improve the density and not full coverage. It is more about natural volume than blending with the numbers.
Do women need to shave their heads for the procedure?
That's a very common question I face. No, most women don't need to shave completely. We can do unshaven, partially shaven, zonal shaven hair transplants where a small section of hair is trimmed and we can hide it by the existing long hairs. For men, however, shaving is important to make the process smoother, faster and cleaner.
What about the recovery or results? Are they different?
Recovery is similar, but women's results often blend in more seamlessly because they have already existing surrounding hair. In men, the transformation is more visible since we are covering bald areas other than the hairline. Women may also benefit from medical therapies like PRP, GFC, etc., along with transplant to maintain better results.
Lastly, what would be your advice to anyone, man or woman, thinking about hair transplant?
My biggest advice is don't wait too long. Hair restoration works best when we plan early. And always remember, every patient is unique. The strategy for a man will never be identical to that of a woman. That's why a personalized approach is the key to natural and long-lasting results. If you are facing hair loss, whether you are a male or female, you can always visit Neo Follicle Hair Transplant Clinic and meet me. We'll assess your case and guide you the best treatment plan.